Hi, everybody. We're here to discuss our project today, which is about the implementation of the UK safety pod to the acute inpatient adolescent psychiatry unit with the goal of reducing floor restraints for our patients.
Everyone has the right to be treated with respect and dignity and deserves to have their rights met and recognized and given the right support. The leadership team at CHIO began to see increasing rates of restraints and increasing staff injuries. We knew something had to change. Learning about the UK safety pods was quite by accident, and through an incredible amount of work by the leadership team, we became the first organization within North America to implement these.
Extensive research documents the dangers that floor restraints can pose to youth physical and psychological health, in addition to the risk of harm to staff that are engaged in the restraint process and the fracturing of therapeutic alliance that can happen when youth are put into restraints, which was part of why we sought to reduce these.
There are many benefits to using safety pods to reduce floor restraints. They provide a less traumatic and less frightening intervention, helping to maintain the dignity of clients. There's a decreased risk of both physical and psychological injury for both patients and staff. And this helps to improve staff retention and client involvement in care.
So what is the UK safety pod? It's really just a piece of furniture, a large, comfortable beanbag chair, perfect for relaxing, and designed in a way that provides comfort and deep pressure. It was designed in the UK by a team of experts, but really created with restraint in mind. Its impact hood and impact vent expel air and allow the hood to inflate, which protects the back and head and allows for optimal chest expansion. The material it's made of also allows for it to be cleaned properly by IPAC standards and has high strength and is puncture proof, which makes it safer for both patients and staff.
And whereas in a typical ground restraint, oftentimes multiple staff, 4 or 5 staff, will be needed to restrain a patient on the floor, and the floor is a hard surface that the patient can push against, which risks injury and ineffective restraint. The pod restraint, similarly to if you've ever tried to stand up out of a beanbag chair, the pod is a safe, soft piece of furniture that a patient kind of sinks into a little bit, and therefore they can be restrained with 2 or 3 staff, and where there's less risk of physical injury and trauma.
And the pod isn't just used for restraint. It can be used for youth to sit in, relax, and engage in various low-stim activities, used proactively by our patients to de-escalate and manage their own emotions, and by caregivers, families, and those present on our unit as ways to engage and spend time together.
We first began discussing UK safety pods in June of 2021 and reached out to the company later that summer. By December 2021, we had applied and received approval from both Health Canada and to CHIO's product evaluation team to use the safety pod at CHIO. In April of 2022, we had a visit from the UK Safety Pods company and began initial CHIO staff training. At that time, we placed several safety pods on the inpatient unit with a clear plan to not use the pod for anything other than a regular piece of furniture and never to refer to them as a safety pod or a restraint pod.
In late June 2022, all of our mental health, emergency room, and security staff were trained and could now use the pods for restraints. We made changes to our electronic health record system to monitor and allow for data collection, and we've had lots of ongoing training and expansion since then. In spring of 2023, we had our second site visit from the UK pod staff, and currently they are seen as comfortable spaces for youth and families to utilize, but can also be used for restraint if needed.
And in terms of how they've been working, so they've decreased the amount of time that patients have spent in physical restraints from an average monthly total of 4,600 minutes down to 1,132 minutes, which represents about a quarter of the pre-intervention values. And looking at the chart, you can see the floor restraints, which was the outcome of interest. As the pod was introduced, you see the number of floor restraints decreases dramatically, whereas the number of pod restraints has gone up, which in our view constitutes a successful implementation.
In other ways we've seen it work, in addition to restraint, we've supported anxious youth throughout our building, offering pods instead of stretchers, offering pods during blood draws or difficult procedures. We've also supported breastfeeding moms and siblings during end-of-life care.
This innovative piece of technology has been successfully implemented across mental health units throughout our hospital and has been met with positive responses from staff throughout our department. We're excited to share our findings and experiences with you all today. We've presented the implementation of UK safety pods at several conferences throughout Canada now. Many organizations have reached out to us for further information, and we're happy to support anyone interested in implementing UK safety pods. Thank you.
Thank you all for listening.